Welcome to our presentation on the sciatic nerve. Here you'll learn about its origins, its pathways, what it innervates, and the injuries associated with the nerve.
Hi! So, the sciatic nerve originates from the L4 to the S3 region. It then exits through the greater sciatic notch, as you can see here, and travels under the piriformis muscle. It's sandwiched between the glute max and the deep gluteal muscles. So imagine the sciatic nerve being the bacon in a sandwich, basically. It lies in the posterior aspect of the thigh and deep to biceps femoris. The sciatic nerve ends at the bifurcation at the apex of the popliteal fossa.
Although the sciatic nerve is referred to as a single nerve, it is actually two nerves, the tibial and the common fibular, enclosed in a common sheath. The separation of these nerves usually occurs superior to the popliteal fossa. However, in approximately 13% of the population, the sciatic nerve bifurcates at the pelvic region. Most of these pelvic bifurcations occur inferior to the piriformis muscle. In 12%, the common fibular nerve pierces the piriformis muscle, while in 0.5%, the common fibular nerve emerges superior to the piriformis muscle. In all cases, the tibial nerve runs inferior to the piriformis muscle.
The tibial nerve innervates all muscles within the posterior thigh region, except for the small head of biceps femoris, which is innervated by the common fibular nerve. Go distal to the popliteal fossa, the tibial nerve innervates all muscles of the posterior leg and all intrinsic muscles of the foot. The common fibular nerve travels to the anterior lateral side of the leg to innervate the muscles in this region. It also innervates extensor digitorum brevis and the first two dorsal interossei on the sole of the foot.
The injuries on the sciatic nerve result in sciatica, which is a set of symptoms and not a disease. Sciatica results from compression or irritation of the nerve itself or to the lumbar nerves L3 to L5 or sacral nerves S1 to S3. Symptoms of sciatica include lower back and buttock pain, numbness or weakness in various parts of the leg and foot, which may include pins and needles, and difficulty moving or controlling the leg.
Hello, doctor.
Timmy, what's happening?
Oh, I slipped a disc in my back and now I've got tingling all down my leg.
Alright, let's lay down, let's take a look.
Thanks.
Timmy's lumbar intervertebral disc slipped and impinged upon the spinal nerves that form the sciatic nerve, causing him pain and occasional paralysis in the lower limb. He undertook corrective medical surgery and was on the road to recovery in no time.
Oh, poor Johnny. He's got piriformis syndrome. That's when the piriformis muscle tightens and goes into spasms or swells. This then compresses the sciatic nerve that lies beneath it. To treat Johnny's piriformis syndrome, he is required to do corrective exercises to stretch and lengthen the piriformis muscle. This should decompress the sciatic nerve. Injury is lumbar spinal canal stenosis. This is the narrowing of the lumbar spinal canal that puts pressure on the sciatic nerve. This mainly affects the elderly. This can be treated by a laminectomy, which is the removal of a vertebral lamina that widens the spinal canal. Sciatica can also be caused by tumors, which impinge on the spinal cord or the nerve roots of the sciatic nerve. Improper injections into the gluteal region can pierce the sciatic nerve and result in loss of sensory function. This can be prevented by injecting into the superior lateral part of the gluteal region, which is also known as the safe zone.
all muscles within the posterior. The tibial nerve innervates all muscles within the posterior.
Is that mine?
And may also include
Enclosed in a common sheath. What?
Intervertebral disc slipped and impinged upon the spine.
the common fibular nerve innervates all muscles.
Yeah. Bitch.
Yes.